Hi, I'm Dr. Gerald Nissley, and this is a recorded announcement for Psychopathology for Mid-American Christian University, period. I thought that this week we would just kind of go over the expectations for our final week and discuss the upcoming final project. So here goes nothing. Give you a chance to hear my voice and see my face, which is a little different sometimes for these online courses. So at any rate, I wanted to just kind of go over the expectations. As we think about them, some of them are very similar to what they've been for other weeks. This week we are going over neurocognitive disorders, such as neurocognitive disorder itself, what we used to call dementia, and delirium. You'll find out as you read the DSM-5 this week that there are all kinds of diseases that can promote neurocognitive declines in particularly the elderly, but it can strike much earlier than that as well. And so you'll read through the diagnostic criteria in the DSM-5 primarily for your reading assignment. For your research question, you'll submit to me an assignment very similar to what you've submitted in previous weeks, just basically a build-up that accumulates your understanding of how to effectively diagnose as you've learned about various aspects throughout the semester. And so you'll provide that to me by Friday at before midnight, which is a little different than usual, so be aware of that. You will write a case study like you have previously. Your case study should be in the Dropbox by this upcoming Monday. I believe it's the 23rd. This again will be one that you create yourself that demonstrates your understanding of neurocognitive disorders. And then for our case study discussion this week it will be a little different in that the case study that will be utilized for our discussion is not preloaded into the course room. If you go to the discussion section, you'll see that I've uploaded a case study on an individual named Betty, and we'll utilize that as the backdrop of our discussion this week. And so on Friday morning, if you want to go on there and identify the symptoms that you see in Betty's case, by Sunday you'll then post your diagnosis. What would you diagnose Betty with based on the information presented? And we'll continue conversating over that through Monday. And so you'll find her case in a PDF format in the discussion area for week 8. And then lastly, this week you have your final case project due. That case will be over the case of Mr. Lawler, and Mr. Lawler's case can be found in the content browser where you've found other PDFs of other case studies we've done. His case is there, and the case study rubric for the final project is there as well. That project will be due in the Dropbox by the 23rd, which is Monday. And as you'll see as you review Mr. Lawler's case, it's a bit complex. And so it should provide you an interesting opportunity to apply the things you've learned over the semester in conceptualizing his case. A couple words of wisdom. Use the feedback that you've received throughout the semester on the case studies you've performed to help you to think through his case. Particularly be mindful to directly consider socio-cultural, developmental, lifespan aspects of Mr. Lawler's case and how they might apply to both diagnosis of Mr. Lawler, but also for how to understand his symptoms and the progression of his illness. Be sure to include your reflections on that, as that's a really important part of psychodiagnostics. And it's one that occasionally in the process, sometimes students forget to kind of think about deeply. And so make sure that you take the time to do that. Otherwise, it's a very similar rubric, very similar expectations to previous case analyses you've done in the course. Just the case, I believe, is a little more complex. And so be sure to take time and think deeply through that. But that'll be due on Monday the 23rd. As this is the only time for most of you that you'll hear my voice during this semester, I just wanted to let you know how happy I am to have facilitated this course with you. It's been a hoot just kind of getting to know you a little bit and to interact with you over the work I do every day as a clinical psychologist. And very much this is a topic that's so important for clinicians to understand. If we can effectively diagnose and understand illness, we can more effectively treat it and more effectively be Jesus with his skin on in a world that desperately needs it. And so it's been a pleasure facilitating the class, and for those of you that I don't get to extend to verbally or otherwise, best wishes as you go forth. Peace be with you.